Tonight, cases of the coronavirus continue to grow. Now, worldwide, the virus has killed 3,000 people, nearly 90,000 cases overall. And that now includes 3 presumptive cases in Oregon. In total, more than 100 people in Oregon are under investigation. At 11 o'clock tonight, I'm Jennifer Hoff.
And I'm Jeff Gianola. Also tonight, Kaiser Permanente Hospital in Hillsborough asking staff who were exposed to the virus not to come back to work for 2 weeks.
Let's switch to our Jenny Young. She's live tonight with more information on that and what else she is learning from state health officials. Jenny?
Jeff, Jennifer, as we've been reporting, the very first patient here in Oregon to be diagnosed with that virus, he is being hospitalized here at the hospital. Now, they are asking those staff members, this includes doctors and nurses and other staff, if they came in contact with him before he was diagnosed with this, before it was confirmed. They're asking those people to self-quarantine for 14 days. Now, we also talked to state health officials who say that the virus, the people most vulnerable, elderly and those with compromised immune systems.
Yeah, so typically what we're looking for with COVID-19 is patients often have a fever, and then they typically develop a cough or some shortness of breath or trouble breathing.
A public school shut down, doctors and nurses in quarantine, nervous families buying out hand sanitizer and other sanitation products.
Well, I know that people are scared here in Oregon.
As the medical community rushes to learn more about the new coronavirus, COVID-19, we asked Oregon health authorities who is most at risk for getting the virus and what you need to know to keep your family healthy.
COVID-19 is spread in droplets when someone coughs or sneezes. Usually within 6 feet of them is the people who are most at risk. Just walking by someone in the hallway, even having a brief conversation with someone in line, for example, in a grocery store or something, isn't enough to transmit this virus from one person to another.
Since Friday, the Oregon State Public Health Lab has tested more than a dozen patient samples that have come back negative for COVID-19. Dr. Dean Seidlinger isn't new at dealing with the public's fear of a potential pandemic.
COVID-19 has some very similar characteristics. We don't know how serious it is, so we continue to evaluate those numbers. There's not a vaccine yet, but some of the tried and true tools of staying home when you're sick, washing your hands, covering your cough and sneezes, and trying not to touch your mouth and eyes are some symptoms we can have to keep people healthy, and those steps also keep your family and community healthy.
So that second confirmed patient not being hospitalized tonight, being asked to self-quarantine for 2 weeks. That patient is a roommate of the first confirmed case. That third is an Oregonian, but that person is being hospitalized in Walla Walla. Back to you guys.